Hi everyone, my name is Divya Sharma and I'm a current dermatology resident at the University of Nebraska Medical Center. I am excited to share with you our presentation titled Skin Cancer Risk and Climate Change. To start, here is a resource map and here are some keywords for this presentation. For our learning objectives, they include being able to describe mechanisms by which increased temperatures, decreased stratospheric ozone, and air pollution contribute to skin cancer rates, describing how the effects of increased temperature, stratospheric ozone depletion, and air pollution impact health equity and social determinants of health as they relate to skin cancer risk. And finally, discussing clinical practice implications relating to skin cancer prevention amid a changing climate. We'll start with a case study. This is a 57-year-old white male who works outdoors in an urban setting presenting with this new growth on his nose. He notes this lesion has slowly grown over the past few months and often bleeds. Physical exam is significant for a 0.4 centimeter pink, shiny telangiectatic papule on the right nasal sidewall, as can be seen here in this picture. Continuing with the case, the patient has lived his entire life in Arizona. He reports growing up in an urban area and remaining there to work various outdoor jobs in his community. He has a high school education, an annual income of $30,000, and he lacks health insurance. He's been a landscaper for the last 20 years and denies using any sun protective measures during his career. He knows often getting sunburned while working and reports rare events of blistering and severe pain from these sunburns. Now, switching gears and talking about skin cancer epidemiology and risk factors. Skin cancer is the most common cancer worldwide and is increasing in incidence. About 90% of non-melanoma skin cancers are associated with exposure to UVA and UVB radiation from the sun. UVA and UVB radiation causes DNA mutations which overwhelm innate repair mechanisms that promote tumorigenesis. Common risk factors for skin cancer include fair skin, so 35 to 45% of all neoplasms are in Caucasians, 4 to 5% in Hispanics, 2 to 4% in Asians, and 1 to 2% in Blacks. Another risk factor is excessive cumulative sun exposure. This includes childhood sunburns, living at a high altitude, outdoor occupations, and tanning. Although darker skin types have a decreased overall risk of skin cancer, these populations still face the disease burden. In the US, 1 out of 5 jobs are outdoor occupations and are primarily held by Black and Latino workers. And an estimated 5-year melanoma survival rate for Black patients is 71%, while it is 93% for white patients. Now, how does climate change truly affect skin cancer? Well, first we'll talk about stratospheric ozone depletion. The ozone layer is protective against UV light, as can be seen in this photo. Certain substances have been known to destruct the ozone layer, such as chlorofluorocarbons, and this results in an increased exposure to UV light, which, as we just talked about, is one of the most important environmental risk factors for cutaneous malignancies. Additionally, air pollution enhances cutaneous carcinogenesis. This is through maladaptive cellular responses, activation of the aryl hydrocarbon receptor, which is well known in the oncology world, reactive oxygen species generation, inflammatory cytokine production, and a synergistic effect of air pollution with UV exposure in carcinogenesis. Additionally, increased temperatures due to human-related emissions of greenhouse gases can affect skin cancer risk. This is through a similar synergistic carcinogenic effect with UV exposure. Additionally, it's important to consider behavioral implications with a warmer climate. When temperatures rise, people are more likely to go outside and spend time in the sun. There's also an urban heat island effect. In urban areas, the felt temperature is much higher because there's less foliage, such as grass and trees. Now talking about epidemiology within a changing climate. So there are special populations to consider. Those include people with certain occupations, such as outdoor workers and professional athletes even. They are sometimes more often spending a lot more time in the sun. Those living in a certain geography, so those living at a high altitude and low latitude, those with certain genetic conditions such as albinism, xeroderma pigmentosum, and many others which predispose you to being more sensitive to the sun and DNA damage, and immunosuppressed patients such as solid organ transplant and HIV patients. Now, who will bear the burden of this? There's one population in particular is those who live in urban heat islands and near highways and industrial complexes, as they have an increased exposure to air pollution and increased heat. Additionally, we have to consider those with low socioeconomic status, those within marginalized communities, and the unhoused, who often do live in urban heat islands and near highways and industrial complexes. These populations also tend to have fewer resources, less access to care, and higher rates of medical comorbidities. Finally, what can we do, or what can you do? Well, you can promote sun protective and heat avoidance practices to your patients and communities. You can teach patients how protecting the climate is a public health issue. You can work to make your own practice or health system, or the one you may work in the future, environmentally friendly. One great resource for that is My Green Doctor, which provides much guidance in the area. Additionally, you can join your local, regional, or national medical organization to combat the climate crisis. And you can advocate for climate justice for vulnerable and marginalized populations in your community, in health and government policies, and in research. Thank you very much for your time. If you have any questions, please feel free to contact me or the Climate Consults team. Thank you again.